Hello, and welcome to the Inherent Birth Conference. I'm Aisha El-Hajjar. I'm an American midwife and mother of 8 naturally born children. I'm a midwifery educator and advocate in Saudi Arabia and founder of Amani Birth, an international Islamic childbirth education program that supports couples on their journey to parenthood. Amani Birth is set on a foundation of trusting Allah first and foremost, getting prepared for birth and parenthood, maximizing the inherent safety nets of the childbearing year, and learning to weigh the risks and benefits of any suggested medical tests, procedures, or medications, and consider all the alternatives in order to make informed decisions of consent or refusal of such interventions. At Amani Birth, we believe that Allah is the best of creators and that He created birth to be inherently safe. And we provide workshops to train Amani certified teachers and doulas to work with expectant families in their local communities, as well as working with the medical community as a mentoring platform for care providers working in obstetrics. I'm personally an advocate for mothers' choices in the childbearing year and a supporter of the natural process, whilst encouraging individualized medical care and observation with the least amount of interventions possible, taking into consideration each woman's personal situation, health risks, and history. Amani Birth is proud to be a part of this online conference, and we pray that each person gets the best of it and that it reaches and benefits multitudes around the world. I'm honored to present the title topic, Birth is Inherently Safe. This subject is very dear to me, and I'd like to thank Inherent Birth for allowing me to share my thoughts, ideas, and discoveries about the many ways that our Creator has built in safety nets for pregnancy, labor, birth, and beyond. When we discover the safeties of birth, we must also acknowledge that birth does come with risks. In fact, if you analyze things, everything in life is a risk. Just being alive is risky. I truly believe that every moment, every next breath, is a blessing to be thankful for. With this in mind, I feel that the role of care providers is to educate mothers about the inherent safety nets built into birth so that she can work to maximize them, as well as to explore individual factors in order to expose potential risks and eliminate, reduce, or deal with them. When we stop to consider the potential risks of birth, our goal should be to explore what we can do to minimize those risks within the realms of things we can control. This may include eating healthy foods, exercising, and selecting the care provider best equipped to support our birth plans while also being prepared for any possible complications. We want care providers who are not prone to intervene when intervention is not necessary, as such a scenario can actually introduce extra risk from interfering with what should typically be a natural life event. This equates to a fine balancing act between professional observation for birth without interference unless medically necessary for the best possible outcomes. In fact, I'd like to acknowledge a quote by the World Health Organization that states, "Normal birth, provided it is low risk, only needs close observation by a trained and skilled birth attendant in order to detect early signs of complication. It needs no intervention but encouragement, support, and a little tender loving care. Only general guidelines can be given as to what needs to be in place to protect and sustain normal birth." Once we have done our best to analyze risks and minimize them to the best of our abilities, we can then take rest in recognizing that there are many inherent safety nets built into birth. Discovering them also allows us to do our part to maximize birth safeties and is a first step towards trusting the natural process as designed by the best of all creators with a thankful heart. This in turn allows us to enjoy the journey and replace fear with trust and empowerment. Allah only knows the full degree of safety nets built into the reproductive process. Today, we will take time to discuss just 10 of them. Number 1. The first safety net I'd like to explore is in relationship to the maternal cervix. The cervix is the opening between the vagina and the womb and the structure that needs to dilate to 10 centimeters for the baby to be born. When a woman is pregnant, her cervix is long, closed, and sealed with a mucus plug to keep the baby safe and protected from infection. When the baby is ready to be born, it's the baby's head that begins to apply pressure on the cervix. This is what facilitates thinning and opening of the cervix in labor. A fascinating safety net lies just above the cervix, where the bottom portion of the womb is thin and tight. This section of the uterus is called the isthmus. Because it is thin, it serves to keep the baby's head off the cervix prematurely and thus protects the cervix from pressure too soon. It's the relaxing of the isthmus in late pregnancy that causes the sensation of the baby dropping and begins the pressure on the cervix that will eventually facilitate its effacement, which means thinning, and dilation, which means opening. Additionally, during pregnancy, the cervix is typically tilted towards the mother's back. This posterior position means that there is a misalignment of the cervix to the birth canal until labor contractions pull the cervix forward in alignment with the vagina, when the baby is ready to be born. This is yet another protection from preterm birth. Number 2. Let's also consider the many layers of protection that the baby is wrapped in during pregnancy. From the outside in, we discover the mother's skin and abdominal wall, then her fatty tissues and muscles, followed by the womb itself, all of which surround and protect the baby, keeping him safe from the outside world as he matures. Within the womb are 2 layers of membranes that form the amniotic sac, and within that is the amniotic fluid that provides a constant temperature, cushioning from the outside environment, and protection from infection. It is within this watery atmosphere that our babies grow and thrive without much doing on our part. The baby is so safe and well protected in the womb that the normal bumps and bangs of daily living are highly unlikely to harm the baby. Number 3. The next safety nets I'd like to explore are slow digestion and circulation. When a woman becomes pregnant, her digestion and circulation slow down. This allows her body to absorb more of the nutrients in the food she eats and to pass them over to her baby. Although it's always wise to pay close attention to diet and eat only the best foods in pregnancy, these safety nets help to pick up some of the slack even if the mother doesn't eat perfectly, as her body will be absorbing more of the nutrients in the food she does eat than normal. One downside, however, is that as the food sits longer in the intestines, it becomes drier and can result in constipation or upset stomach and nausea. If we can remember that these symptoms are signs that our body has kicked in with an important safety net to protect our baby, we can take it in stride and be thankful for the natural process that is looking out for our unborn. Number 4. Another safety net is increased blood volume. The typical pregnant woman's blood volume increases by about 50%. This allows for more oxygen carrying capacity, which is a real blessing, as the mother will need to share her circulating oxygen with her growing baby. At the same time, this will also protect the mother from anemia and other potential risks from the amount of blood she'll lose during the afterbirth period. So in essence, this increased blood volume is vital for the well-being of the mother during her postnatal bleeding. But consider this. Blood is made of 3 dietary elements: water, sodium, and protein. So she will need to ensure she's ingesting adequate amounts of each of these nutrients throughout her pregnancy to maximize the built-in safety nets and ensure that she gets the blood volume increase as designed in the blueprint of a safe pregnancy. One side effect to note is an increase in potential for bleeding gums or bloody nose, both of which can be taken in stride when we recognize that it is reflective of a healthy blood volume increase. At the same time, this also highlights the importance of maintaining good dental hygiene during pregnancy because any bacteria in the mouth can more easily enter the bloodstream from the bleeding gums. So the big lesson here is that mothers need to take responsibility to eat well and maintain good care of themselves overall for the safest and best pregnancy outcomes. Number 5. The next safety net we'll explore is loosening of the ligaments and joints towards the ends of pregnancy. This is the result of an increase of relaxin hormone. Its function is to relax the ligaments and joints in the pelvis and soften and widen the cervix. This results in flexibility of the pelvic region so the baby can safely pass through for birth. Similarly related to this is the fact that the baby's skull is not solid until about 2 years of age. This allows the cranial bones to overlap, allowing baby's head to compress and mold to the maternal pelvis and birth canal. The combination of a loosened maternal pelvic region and compression of the baby's head support baby's safe passage through this tight space. Number 6. There are also important safety nets during the second stage of labor. Going through labor is tiring, and the final moments of the first stage can be the most physically and emotionally challenging for mothers, just as she's about to embark on the hard work of pushing her baby into the world. Recognizing the exhaustion that mothers may experience as they work hard to push their baby into the world, we can take heart in the blessings of increased break times between second stage contractions. This occurs when the cervix is fully dilated and the mother suddenly enjoys a nice rest period of between 5 and 15 minutes between contractions. This increased rest time allows her to recoup her energy and perhaps even lie back for a short power nap between the physically challenging pushing contractions. Furthermore, there is a mother-baby dance occurring during the pushing phase of labor, as the baby takes as much part in the birth process as the mother does. It is at this time that the baby is twisting, wiggling, and pushing with his feet to rotate and help propel himself into the world. Mother and baby's efforts are most effective when the mother has opted for natural methods of pain relief and not used medicinal anesthetics for labor. Correspondingly, an alert and physically in control mother has more effective pushing efforts than one who is mentally incapacitated or out of it from pain medications, or simply physically debilitated by being numbed from the waist down. Not to mention that her baby is more alert and able to participate in his own rotation through the pelvis when the mother is undrugged, allowing him to work towards his own birth as well as support the mother's pushing efforts. Furthermore, a mother who is physically in control of her body has more options of pushing positions and is not limited to lying on her back with her feet in the air, the most ineffective and difficult position for birth, yet the most common, as many mothers use epidurals and cannot use their legs to assume a more instinctive position. In fact, when left to instinct, most mothers will naturally assume an upright, kneeling, or squatting position for birth, which has been shown to open up the pelvic outlet by about 30% as compared to lying on the back with feet in stirrups. Squatting also shortens the vagina, thereby reducing the time it takes to push the baby out. This is an important safety net as the passage through the birth canal can be stressful on the baby, and it's a blessing to naturally limit the length of time the baby is subjected to this stressful phase of the labor. These important safety nets help the mother have the strength required to bring her baby into the world herself, without need for interventive assistance, which also leads to yet another safety net, the fetal Heimlich maneuver. The fetal Heimlich maneuver refers to the squeezing of the baby as it passes through the tight vaginal opening during birth. The natural pressure of the tight passage results in the mother's tissue pressing inwards on the baby's diaphragm as he's born and results in the baby spitting up the majority of the fluid in his lungs just as he's born. The baby who is born over an uncut perineum typically does not need any suctioning at birth and just naturally breathes on his own. Unfortunately, in too many places around the world, our care providers continue to intervene at the moment of birth by cutting routine episiotomies. Episiotomy is a rarely needed, damaging, and outdated surgical procedure that typically inflicts more harm than good. It is a cut in the smooth tissue between the vagina and anus performed to widen the vaginal opening and shorten the stressful pushing phase of labor by a contraction or two. The benefits of a slightly shorter pushing phase typically do not outweigh the damage done to the mother's vaginal tissues and loss of beneficial Heimlich maneuver. The argument that the mother may tear if she isn't cut is not current evidence-based practice, as statistics show that a large percentage of women won't tear at all, and even if they do, the tear is statistically likely to be less damaging than the medical incision. In fact, the World Health Organization and the American College of Obstetricians and Gynecologists state that the practice of episiotomy should not be performed unless there is a pressing medical emergency to justify it. The World Health Organization further states that the maximum recommended rate for episiotomy should not exceed 10% of the worldwide birthing population. This reflects an understanding of the built-in safety net inherent in the natural process of the baby being squeezed into the world through a naturally tight vaginal opening in order to clear out his lungs of fluid in preparation for the first breaths. A final thought about the benefits of the second stage of labor is in regards to the beneficial vaginal flora that the baby acquires as he passes through the birth canal. These microbes are an important element in establishing a healthy gut biome and are a foundational safety net of the child's lifelong health. Number 7. After birth, we are wise to take advantage of breastfeeding. There are many safety nets wrapped up in this simple motherly act. Let's look at the safeties for mother and then baby. First of all, the act of breastfeeding causes after-birth contractions for the mother. These contractions help to shrink the uterus, thereby shearing the placenta off the uterine wall and effectively clamping down on the open blood vessels where the placenta used to be attached. A well-contracted uterus prevents postpartum hemorrhage and protects the mother from loss of too much blood and reduces the risk of resultant death after birth. Second, studies have shown that when a mother breastfeeds for 2 years, whether for one child or a combination of children, it reduces her risk of breast and ovarian cancers by 50%. Not to mention that once mastered, breastfeeding is the simplest, safest, and cheapest way to nurture and feed the baby. From the baby's perspective, breastfeeding immediately after birth provides just the right amount of nutrients in the form of colostrum. This first milk that is yellow and sticky is often referred to as liquid gold. Colostrum is small in amount as baby's stomach capacity is extremely small at birth, yet packed with important elements for the baby's first feed. It is a laxative that cleans the baby's digestive system of the first poo, which is called meconium, and is a thick and sticky substance that resembles tar. Colostrum is also full of antibodies that is a natural immunity boost for the safety of the baby at birth. This first feed should not be interrupted, and it's always preferable for the baby to start his life with the benefits of mother's milk directly from the breast whenever feasible. The more mature milk is equally amazing as it adjusts in content and thickness to the baby's needs and environment. Each feed is unique as the composition of the milk adapts to provide immunological protection based on the baby's changing atmosphere. It also changes in composition, being more watery in warm climates and thicker in colder surroundings. Man-made formula milk can never compare with the flexibility of mother's milk as it responds to the baby's immediate and changing needs, as well as the simple laws of supply and demand, where the more milk removed, the more milk mother's body will produce. Formula milk has also been proven to cause tummy upset, constipation, rashes, and other acute illnesses, not to mention a higher risk of diabetes, obesity, heart disease, and other long-term illnesses in later life. Simply put, there is no comparison to breast milk, which is the norm for which babies were created to consume. Human milk is designed for human babies, and breast milk is all the child needs for the first 6 months of life. But breast milk continues to benefit the baby well past 6 months, as it supports his growth and nutritional needs while complementary foods are added to the growing child's diet from 6 months onwards. Also take note that there is more to breastfeeding than nutrition. Nursing is a nurturing and bonding activity that builds a close relationship between mother and child. It is comforting to the baby and provides for a sense of security and safety that extends far beyond his need to eat. Incredibly, breast milk has anesthetic properties which serve to soothe the baby in times of physical pains. It's no wonder that a mother's instinct is to bring her baby to the breast when he cries, especially after suffering the normal bumps and bangs of early childhood. When pondering at what age to wean the child, please consider that the immunological properties of breast milk are an important safety net as the child matures and begins to interact with other children in the world, such as at social gatherings like malls and parks, as well as interactions in the child care setting. Remember that this is an important part of building the child's immune system, and there is wisdom behind the Quran and the World Health Organization suggesting that the desired term of breastfeeding should be for 2 years. Number 8. Another safety net for our babies is Vernix caseosa, the thick, white, creamy substance that coats the baby's skin in the womb. Vernix provides a layer of protection while the baby grows in the watery environment of the womb, provides a lubricant of sorts during the passage to the birth canal, and provides a physical barrier against pathogens, bacteria, and viruses in the baby's environment after birth. It also helps the baby to regulate his temperature after birth, providing a film of protection against his cold new world. It is advisable not to rush in washing the substance off the baby's skin at birth. Towel the baby down to remove any wetness or blood that may appear on the skin, but leave the vernix intact. In fact, baby doesn't really need a full immersion bath until the umbilical stump falls off 10 to 14 days after birth. Although you will need to keep the diaper area and under the folds of the neck clean as baby passes bowel and spits up. Vernix has been called baby's first lotion and may be rubbed into the skin, especially if there is a lot of it. But the bottom line is, don't rush to bathe the baby. Number 9. The next safety nets to discover are related to the umbilical cord. First of all, there is mucus tissue within the umbilical cord that protects and insulates the umbilical blood, called Wharton's jelly. Amazingly, the substance thickens as it is exposed to temperature changes after birth and thus collapses the arteries and vein within the umbilical cord, resulting in a physiologic clamping of the cord about 5 minutes after birth. When we delay clamping the cord and wait for the physiologic process to take place, there is a significant transfer of blood from the placenta to the baby. We have discovered scientifically that it's best to wait to clamp the cord until it stops pulsing. In fact, the World Health Organization and other major players in maternal and child health are urging doctors and other care providers to stop the practice of immediate cord clamping and delay the intervention for at least 1 to 3 minutes, if not longer. Benefits of delayed cord clamping include the following. An extra source of oxygenation as the placenta continues to provide oxygen-rich blood to the baby as he or she takes the first breaths. This can be an especially important safety net for a baby who is having trouble breathing right away and needs neonatal resuscitation, which, by the way, is best performed between the mother's legs so that the baby can benefit from the intact placenta and the oxygenated placental blood he or she is breathing normally. Additionally, the umbilical cord is full of stem cells. These amazing cells can travel anywhere throughout the body and heal damage that may have occurred during the bumpy journey through the pelvis. Delaying the cord clamping ensures that the baby gets the stem cells that were designed to be provided immediately after birth, which will facilitate any seen or hidden needs for healing. Also consider that the circulating blood between the baby and the placenta is all part of the baby's overall blood volume. At birth, 1/3 of this blood is stranded out in the placenta. If we immediately clamp the cord, we are effectively robbing the baby of this blood, and studies show that the baby will suffer an anemic status for the first 6 months as his little body works to replace the blood that was rightfully his. A final thought is that when the cord is clamped immediately, the placenta will be heavier with fetal blood, as opposed to delaying the clamping and allowing the blood to transfer to the baby. Although not scientifically proven, one would think theoretically that a lighter placenta would be less taxing on the mother's body as it is sheared off the uterine wall. All in all, at the end of the day, delaying the cord clamping for as little as 1 to 3 minutes has significant proven benefits to the child, causes no harm, and may even be of benefit to the mother as well. Another safety net related to the umbilical cord is that its length is typically just long enough for the baby to reach mother's breast, where baby can begin to immediately nuzzle or nurse. This allows mother and baby to benefit from immediate breastfeeding without having to disconnect from the placenta prematurely. Number 10. The final safety net we'll explore is related to primitive neonatal reflexes. This topic alone is quite extensive and fascinating, especially as it relates to breastfeeding and survival. I first discovered the importance of babies' innate reflex behaviors and their impact on breastfeeding success or frustrations during a lecture series by Dr. Suzanne Colson, a researcher and founder of Biological Nurturing and promoter of laid-back nursing. Amazing, Dr. Colson's research uncovered 20 newborn reflexes that can either support breastfeeding success or obstruct it. We'll explore just a few of them here today, but I highly suggest that you visit her website at www.biologicalnurturing.com to learn more. One of the most profound things she discovered in her research is the direct relationship between the mother's position and the effectiveness of baby's natural reflexes that are designed to facilitate breastfeeding and survival. When she observed mothers nursing and noted what was happening with the baby's natural behaviors, she realized that mothers who assumed a comfortable, laid-back position to feed were more relaxed, and their babies seemed to have easier and more instinctual breastfeeding experiences, as compared to those who sat more upright and assumed the traditional cradle hold that has been taught to new mothers over the past few generations. Furthermore, Dr. Colson expressed that when mothers focus on teachings about breastfeeding positions and correct latch, they become worried and anxious about doing it right. The mother's concerns about precision in breastfeeding make the activity one of stress and adrenaline, which is counterproductive to successful breastfeeding. On the other hand, when mothers lay back, they naturally relaxed and focused more on enjoying their baby, which encouraged a flood of maternal oxytocin, the loving and bonding hormones that trigger her letdown of milk. And the laid-back nursing position, she found that breastfeeding became a more natural one and a relationship-driven experience, rather than a mechanical one. Digging deeper, Dr. Colson realized that human babies, like all mammal species, are frontal feeders. For animals such as dogs and cats, this means that the puppy's or kitten's frontal regions rest on the floor as they snuggle in to feed. You would never imagine a dog or a cat lying on its back and nursing with its mother. When we observe this in humans, Dr. Colson uncovered that newborn babies specifically nurse best when the baby's tummy hugs the contours of the mother's reclined body, extending from the baby's sternum to the pubis. Additionally, in the frontal positions, the baby's legs and feet are usually applied to the mother's body or the underlying environment, such as the bed or sofa, chair, etc. This initiates the newborn's stepping and Babinski reflexes. The stepping reflex is present from birth until about 6 weeks of age and creates movements in which the baby attempts placing one foot in front of the other. When lying across the mother's body, it resembles a crawling motion that propels the baby towards the breast until a successful latch is achieved. This is combined with the Babinski reflex, in which the stimulus on the bottom of the baby's foot causes the toes to fan out, giving the baby more ability to grip into the mother's body as he moves himself towards the breast. Alternately, Dr. Colson found that upright positions unintentionally perpetuated a dorsal feeding sensation, where the baby feels he's laying on his back, as they require the mother to counteract gravity and hold the baby across the back. Positions such as the cradle hold require the mother to apply pressure from the head to the mid-back or even pelvic region of the baby as she brings baby into her breast and also leaves the baby's legs and feet awkwardly dangling. Unfortunately, the pressure across the back creates a sense of dorsal instability and unleashes the newborn's Moro reflex, in which the baby's head and legs extend as he flails his arms as if he feels he's falling. Can you imagine how difficult it would be to comfortably relax and nurse if you had a sense that you were falling? On the other hand, when baby is in a more abdominal position, lying across the mother's body, gravity keeps the baby on the mother's body and the mother's hands are free so she can relax as she no longer has to apply pressure to hold the baby in place. This also unlocks additional primitive neonatal reflexes in the baby that assist the baby in finding the breast on his own. This includes the Babkin and rooting reflexes. The Babkin reflex occurs when the baby's hands face downward on the mother's body, and the pressure evokes head flexion and rotation and bobbing up and down as the baby discovers the breast, and combines this with the rooting reflex as the baby's cheek brushes against the mother's breast, resulting in the baby automatically turning towards the breast with an open mouth. These reflexes allow the mother to relax as the baby figures out the latching process all by himself, rather than the tense mother stressfully trying to force the nipple into his mouth at just the right moment. These and other findings supported Coulson's theories about the importance of the mother's comfortable and instinctive laid-back positions relative to newborn reflexes and the mother-baby enjoyment of a relaxed breastfeeding relationship. Unfortunately, our modern breastfeeding instructions have been interrupting and distracting mothers' natural nurturing instincts by focusing on teachings about how to breastfeed, as if it is a learned behavior that women need to do to their babies, rather than an enjoyable and intuitive activity that is experienced with their babies. The stress of learning breastfeeding theory, as women have been taught to sit up and assume a posture mimicking the 20th century bottle feeding norms where baby is in a more dorsal feeding position, is counterproductive to mother's instincts and to newborn reflexes. Encouraging mothers to allow their babies to lead the latch with his innate primitive reflexes, ensuring they are comfortably laid back with baby in a natural frontal feeding position, allows the inherent safety nets of mother-child bonding and infant survival instincts to flourish. As you can see, there are many natural safety nets built into the childbearing process. Being aware of them helps us to avoid pitfalls of unnecessary interventions and maximizes our inherent ability to conceive, carry, birth, and feed our infants. Although we will never know the true number of such safeties, we can rest assured that our normal physiology is designed to keep mothers and babies inherently safe through this miraculous journey. Thanks so much for listening. And we'd love to hear from you at our website, www.amanibirth.com. And remember, birth is inherently safe.
يا إله الكون تبقى نور من ضل وضاع أنت أسمى أنت أنقى أنت للروح شراع يا إله الكون تبقى نور من ضل وضاع أنت أسمى أنت أنقى أنت للروح شراع من لدمع سال أبكى عينه تشكي الوداع من لقلب بات يشقى عشرة ترمى حسبنا رب تولى عننا من خانبا عانق الذنب فأمسى غافلا للهو راح يا إله الكون تبقى نور من ضل وضاع أنت أسمى أنت أنقى أنت للروح شراع يا إله الكون تبقى نور من ضل وضاع. أنت أسمى أنت أنقى، أنت للروح شراع. باسمك اللهم نحيا بالوجود بلا قناع، من وتى النفس وأقصى ما تريد بلا نزاع. حبك للكون أزهى، حبك أجمل متاع. اهدنا يا رب تقوى تشترى لما تباع. يا عمري اللي راحت أحلام أوهام، إن كان ما ضمت يمينك يميني. يا إله الكون تبقى، نور من ضل وضاع. أنت أسمى أنت أنقى، أنت للروح شراع. يا إله الكون تبقى، نور من ضل وضاع. أنت أسمى أنت أنقى، أنت للروح شراع. ربنا للقرب نسعى كي نكون كمن أطاع. من لنا جنب وسلوى إن دنا الشر وشاء. من لمكلوم فأضحى همه للحزن داع. من لمظلوم تهاوى يبني للظالم قلاع. يا إله الكون تبقى، نور من ضل وضاع. أنت أسمى أنت أنقى، أنت للروح شراع. يا إله الكون تبقى، نور من ضل وضاع. أنت أسمى أنت أنقى، أنت للروح شراع. من لدمع سال أبكى عينه تشكي الوداع. من لقلب بات يشقى عشرة ترمى بقاع. حسبنا رب تولى عننا من خانبا. عانق الذنب فأمسى غافلا للهو راح. يا إله الكون تبقى، نور من ضل وضاع. أنت أسمى أنت أنقى، أنت للروح شراع. يا إله الكون تبقى، نور من ضل وضاع. أنت أسمى أنت أنقى، أنت للروح شراع. باسمك اللهم نحيا بالوجود بلا قناع. من وتى النفس وأقصى ما تريد بلا نزاع. حبك للكون أزهى، حبك أجمل متاع. اهدنا يا رب تقوى تشترى لما تباع. يا عمري اللي راحت أحلام أوهام، إن كان ما ضمت يمينك يميني.
نكون كمن أطاع. من لنا جنب وسلوى إن دنا الشر وشاء. من لمكلوم فأضحى همه للحزن داع. من لمظلوم تهاوى يبني للظالم قلاع.
يا إله الكون تبقى نور من ضل وضاع. أنت أسمى أنت أنقى أنت للروح شراع. يا إله الكون تبقى نور من ضل وضاع. أنت أسمى أنت أنقى أنت للروح شراع.
من لدمع سال أبكى عينه تشكي الوداع. من لقلب بات يشقى عشرة ترمى بقاع. حسبنا رب تولى عننا من خانبا. عانق الذنب فأمسى غافلا للهو راح.
يا إله الكون تبقى نور من ضل وضاع. أنت أسمى أنت أنقى أنت للروح شراع. يا إله الكون تبقى نور من ضل وضاع. أنت أسمى أنت أنقى أنت للروح شراع.
باسمك اللهم نحيا بالوجود بلا قناع. من النفس وأقصى ما تريد بلا نزاع. حبك للكون أزهى حبك أجمل متاع. اهدنا يا رب تقوى تشترى لما تباع.
راحت أحلام أوهام إن كان ما ضمت يمينك يميني.
يا إله الكون تبقى نور من ضل وضاع. أنت أسمى أنت أنقى أنت للروح شراع. يا إله الكون تبقى نور من ضل وضاع. أنت أسمى أنت أنقى أنت للروح شراع.
ربنا للقرب نسعى كي نكون كمن أطاع. من لنا جنب وسلوى إن دنا الشر وشاء. من لمكلوم فأضحى همه للحزن داع. من لمظلوم تهاوى